Kathy, what are your thoughts about why JJ wasn't referred for sperm banking? Like what goes through the provider's day and how does this get dropped?
Yeah, I think what happens is number one, often a healthcare provider is often very surprised to see such a young adult in their clinic unless a genetic mutation is identified early on, right? Because the average age patient in the United States is always, you know, roughly the mid to late 60s. So that currently the median age is 66 in the United States for colorectal cancer. So to see, a young individual such as JJ, 27 years old, that's in your clinic, it's surprising, right? And so there's a lot of urgency and the need to get things going as soon as possible for the patient. And I think that's where it's kind of lost in the discussion, where they're so focused on eradicating the tumor, treating the tumor, that they forget about the aftermath, what happens after the tumor's been removed, or what happens is once the treatment's been initiated. You know, it's great that it's addressing the cancer and hopefully preventing any further tumor growth or spread. And in some cases, giving it in the adjuvant setting where the tumor's been removed. But it's easy, I think, when you're unfortunately in a very busy clinic, let's say, you may forget that there are some long-term side effects. And this young gentleman is going to hopefully live in a very, very long life, and he's going to have to plan for a future ahead, but the provider is not necessarily thinking that way during that quick first visit. So we have to kindly remind our healthcare providers how important that is. Just like checking your vital signs when you come into clinic, checking your blood work, there should be a box that says, have you had a discussion regarding fertility? In our consent forms now, it is clearly stated, have you discussed fertility planning. There's a checkmark box for our patients, males and females. But, in 2017, that may not be the case.
We hope you liked this video. To support cancer research and get clear expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.